Sanjeevani Prep welcomes.
Hello friends, welcome to Sanjeevani Prep, and this is our basic video in which we will talk about pharmacology, introduction and its branch. So let's start. So now the term pharmacology is made up of two Greek words from pharmakons and logos. So now the pharma word, right? The pharma word relate from drug, and as you know, logi, as I told you in my prior classes, logi means study and science. So pharma means drug, logos means study, so it is the study of drug. So pharmacology derived from the Greek words that are pharmakon, which means drug, and logos, which means study or science. So for our convenience we use study. So what it means? It means that pharmacology is a study of a drug, its mechanism of action, its nature, all about drug, okay, which we administer in body. So it is a branch of science which deals with the study of drugs for safe and effective medicinal purpose. Okay, we should know that we are using which kind of drug for our medical condition, which kind of disease, which kind of disorder, anything else for what we are taking medicine, and their mechanism of action as well, and that drug how it acting on our body. So that is pharmacology, right? Basically, mechanism of action of drug, its nature and the purpose and its effect. Is it safe or not? Is there any adverse effect of drug? Adverse effect means any bad effect, kind of side effect which you didn't expect, right? Now next one, the branch of pharmacology. There are two branch mainly, right? The first one is pharmacodynamic. As for your easy understanding, pharma means drug, dynamic means, as you know, dynamic, static, dynamic. Static means which do not change, right? And dynamic means which changes, right? So pharmacodynamic means drug changes, the changes which drug induce in our body. Okay, the changes which is induced by drug after administration in the body. Let's see, it is the study of what kind of changes is done in the body by drug after administration. That is pharmacodynamic, means its action, mechanism of action, how it affect our body in a good way or bad maybe. Now pharmacokinetics is pharmaco, as I told you, means drug. Kinetic means, you know, the movement, kinetic energy. So kinetic means movement. It is the study how drug move in body. Okay, it follow ADME. What is it? It is absorption, distribution, metabolism, excretion, right? So it is pharmacokinetic is the study how drug move in our body after we administer the drug, how the drug pass in our body, how it move, where it go. So that include in pharmacokinetics after reaching the site, right? After reaching the site of action, how it affect, that is called pharmacodynamics. I hope you got it. As in book given, pharmacodynamic means what drug does to body, and pharmacokinetic means what body does to drug. Okay, what body does with drug, that is pharmacokinetics, and what drug does with body, what kind of changes a drug does in body, that is pharmacodynamics. Now definition of drug. Drug is a chemical substance that is used to modify, explore physiological system and pathogenic state for benefit of a recipient. Recipient, that person which is taking the drug, that is a recipient. Okay, drug is a chemical substance. Okay, drug is a chemical substance. It is not related to any hallucinating drug or any narcotic drug means, but the drug according to WHO is any chemical substance which you are taking for a good purpose, okay, to modify, to explore your physiological system, okay, and to enhance your pathogenic state, okay, to prevent your pathogenic condition, okay, to modify your pathogenic state for benefit of the recipient, which the person who's taking the medicine for a good purpose, right? Okay, so drug is a chemical substance that is administered in a person to a good purpose, that is called drug, right? So the next term is that pharmacotherapeutics. So what does it mean? Pharmaco means drug, therapeutic means treatment. So it is the application of drug information. Pharma means drug information, right? Pharma means drug. So we have the information about drug, but for treatment with the knowledge of disease. Okay, so we should also know about disease, kind of disease, so we can give a particular drug to treat that disease. So pharmacotherapeutics is the application in which any person having the drug information with knowledge of disease, so it can cure it, so it can prevent it, mitigation it very well, right? Now, so the next term is clinical pharmacology. Clinical means where we test the drug, okay. So it is a scientific study or testing of a new and old drugs which already present, right? So we test them, so we do new discoveries upon that drugs in human body and observe their effect and result. So we do the testing of drug, we do the scientific study of the drug on a human body itself, and then observe the effects on human body of that drug and result, right? If the effect is good or bad, maybe the result is a good or bad, right? If it is good, then good, it is a desirable, and if it is a bad, that is, what is that? That is adverse effect, which is unwanted side effects, right? To determine drug use, what kind of use we can do with that drug, and adverse effect, what are the adverse effects, so we can use it particularly for few patients, okay. Now the next term is chemotherapy. Chemo means chemical. I will tell you by breaking the terms, so you can yourself do it better after a time, okay. Chemotherapy, chemo means chemicals, therapy means treatment, so it is a chemical treatment, okay. It is a chemical treatment of systemic infection, any kind of infection in your body, okay, caused by any pathogens, or malignance, a kind of cancer cell, right, with the specific drug. So have you heard about the chemotherapy for cancer, right? So there are such chemicals that are given to the patient for treatment as a chemotherapy of cancer, right? So to treat the systemic infection and malignancy with a specific drug that have a selective toxicity, which have a selective toxicity for the infecting microbes and malignant cells, that cancerous cells, that kill only the infecting microbe and malignant cell with minimal or no effect on host cell. The patient who is taking this treatment, it will not affect that patient and will give the selective toxicity to the systemic infection and malignant cells, right? Then last term is toxicology. As you know, toxicity, poisonous, right? Logy means study. So any drug, how much it is poisonous, or how much it is dangerous for us to take, okay, because the potency and the concentration of a drug matter a lot. It is the study of a toxic poisonous effects of drug. So it is the study of toxic and poisonous effect of a drug, right? So it may be harmful or not. So we study that, okay, on the living body. On a living body, the drug we took, is it toxic or not? Is it good or bad? Okay. So excessive dose of a drug may cause toxicity, right? If any tissue contain a lot of drug concentration, it may cause what? Toxicity. It may cause toxicity, right, and injure that tissue. It also includes the study of adverse effect of any drug. So if excessive drug may cause any adverse effect, or any drug may also cause adverse effects, so that include under the toxicology of that drug. That's it. So we'll meet in next video. If you like the video, then please press the like button, subscribe the channel. Thank you guys, thanks for watching.